Okay, so on to our last section of the test now, which is situational judgment. Situational judgment is a little different because this doesn't contribute to your overall UCAT score. This is scored within a banding. And if you just look at each university and see how they use your situational judgment score, some universities will look at it quite a lot, some won't use it at all, but it is university dependent. So do have a look at their admission statement. And if you can't find it, feel free to drop them an email and ask, and they should be able to tell you. Okay, so situational judgment, you get scored in bands, as I just said. You get multiple scenarios and 66 items within 26 minutes. And it looks at your ability to apply ethical reasoning of various situations. The situations will be medical or dental based, but you don't need prior knowledge in that. It's, I would say, basically common sense. And it looks at sort of your own sort of ethics. So try to put yourself in the shoes of the situation given to you, and you will make judgments on the appropriateness or the importance of statements in response to a scenario. There's not a right or wrong answer in these questions, but there is a most right and there is a least right answer, if that makes sense. So the instructions, you get given a set of hypothetical scenarios based in a clinical setting or during educational training for a medical or dental career. These may involve a student or clinician in their centre. It doesn't matter whether you want to study medicine or dentistry, you'll probably be given a mix of both. There's no differentiation. But as I say, you don't need prior knowledge in it. It's just about sort of using your own thought processes. You will be asked to rate the importance or the appropriateness of a series of statements in response to the scenario. Some of the questions will require that you rate each response from 4 possible options. Some questions will require that you rate each response from 2 possible options, and other questions will require you to choose the most and least appropriate action to take in response to the situation from the 3 actions provided. So as I was saying, there's not a right or wrong answer, but I have highlighted what would score you sort of the best banding within this throughout these questions. So this is question 1. So the answer to this one, there is actually a 4-part to this question. The potential risk of the liquid presents to the patients in the hospital is very important. Um, Basically, patients always come first, and that's the way it is. For the other questions, we've got the correct responses. A, very important, that someone could slip and hurt themselves. Again, patients come first, or people visiting patients and other staff members. That Mirren is running 5 minutes late for her shift. It's of minor importance. Mirren could take into account that the fact that she is running late. However, the safety of staff and patients should remain your priority. That it's not Mirren's job to clean the hospital, not important at all. The safety of staff and patient comes over everything. Mirren should coordinate an appropriate response to the spilt liquid, even if she herself does not end up cleaning it up. And our second question here. And our answers, we've got D, of not important at all, that the consultant is marking one of his assessments. The overriding consideration should be that B of that of the patient. Assessment should be marked professionally and objectively. This is not an important consideration. Sorry, I tripped over my words a little bit there. But D is the correct response. Yeah. And then again, this is a four-parter, and we've gone for A because the patient's safety and well-being should be the main concern at all times. And then the third one here, correct response is B. This may be true and may be important when deciding how to respond. However, it is based on an assumption and so not a very important consideration. And fourth one, correct response is B, important. So this may be true, so it is important to take it into account. However, as Cameron has received a direct complaint from a patient, this should be followed up regardless of who can support or refute it. So that's the end of my questions there. I hope that's all been useful for you all. This is our contact details. So these videos will be up on our YouTube. We've also got a lot of other videos up on YouTube, and that gets updated. So please do subscribe. And if you've got any questions at all, feel free to email us at study.medicalsciences@newcastle.ac.uk. You can also get in touch with our UniBuddy ambassadors. So if you go to the Newcastle University website, you'll be able to connect to UniBuddies, and we've got current students asking questions on there. But I hope you all enjoyed it, and I hope you've got something for it, and good luck for your UCAT exams. Thank you. Bye.